Hello, my name is Nick Muhammad Haika, and I will be presenting the suggestion for improvement or implementation of the dynamically oriented art therapy by Margaret Numberg. Now, the modern implementation of art therapy. The idea of art therapy within this context seems to be as a tool of expression that is better at ego filtering than just the traditional talk therapy that is within the classical Freudian psychodynamic theories. Therefore, implementing this approach in a more modern context may be easier than expected. Now we land to the biopsychosocial approach. Well, the biopsychosocial approach, as per its name, is the combination of three different distinct aspects, which is the biological makeup of a person, for example, physiological pathology, psychological aspects such as belief, thoughts, emotion, and fears of a person, and lastly, social factors such as social economical, social environmental, and cultural factors within a person. Now, this diagram shows what the biopsychosocial approach really is within the context of health. So, if you can see, the social have peers, family circumstance, school, psychological have self-esteem, coping skills, and social skills. Biological have physical have disabilities and genetic vulnerabilities. Interestingly, you can also see there's overlap between each distinct region. So social and psychological have family relationships and trauma. Psychological and biological have temperament and IQ, and social and biological have drug effects. So it is interesting to understand how each and every single one of these distinct areas interact with one another. Now, why hasn't this approach been popular? Now, research by Kusanto et al. States that even though this model is very much useful, all-encompassing, and a holistic view of health, but due to its nature, it is very much impractical or just plainly too complicated within the context of primary care and family doctors. This is why most clinicians are sticking to the traditional biomedical model of health, in which they focus more towards the biological makeup of a person and also a tiny bit on psychological aspect of a person, but largely they do neglect the social factors within their patient. Continuing on the biopsychosocial approach, with all that being said, Kusanto et al. Did state that the biopsychosocial approach could help in chronic illnesses that originate from physical problems, but will also influence psychological and social aspects of one's life. Now, how does it all come together? Now, what is chronic disease? Now, the CDC, Center of Disease Control and Prevention 2021, states that chronic disease is characterized by a medical condition that lasts 1 year or more and requires ongoing medical attention or limit activities of daily living or both. Now, using the dynamically oriented art therapy within the context of the biopsychosocial approach, it is better in revealing real thoughts and emotion for patients that are going through these chronic diseases. The ego filtering feature of dynamically oriented art therapy would do well in bringing down the natural barriers from client to clinician. With the clinician have a better understanding of the psychological factors that their client is experiencing, they can help the client and plan accordingly on how to cure this problem.